Oh.
I'm going to start recording. Okay. All right. So we're going to be doing, hold on a sec. I got to make sure I get this in the speaker view. Okay. Am I in a speaker view for you guys? Okay. Okay. So what I'm going to do, so I'm big for you guys. Okay. It's different for me. Well, welcome. This is the monthly Zoom meeting for Mountain Mamas. I'm doing the first section is first aid, and we're going to start. We've been talking about assessments and vital signs and what to document and stuff, and now we're going to start going into our actual focused assessment and the things that you're actually looking for when you're doing an assessment. So today is spinal precautions. It's kind of the beginning of, it's something that everyone needs to know and is kind of the beginning of all these focused assessments. So the first thing we're going to do when we come upon a situation, actually I'm going to get my volunteer. JD, do you want to come by? JD, come on down. All right, so you're going to come upon a situation. The first thing we want to make sure is that the scene is safe. So we're going to make sure there's no trees afloat. We don't have like a rock slide coming down. We don't have avalanche or fires, all that kind of stuff. Make sure the scene is safe before you initially go in. And then we're going to do our A, B, C, D, E. So A is airway, breathing, circulation. D is disability, which is what we're doing today, spinal precautions. And then E is environment. So we're going to be focusing on the D today. So after you kind of go through the A, B, C, Ds and your priorities, then you would do your focused exam. So we come upon somebody and he's lying down here.
Hello.
Hey, JD.
What's up?
This is our unconscious state. Okay. All right, so we have a guy here. You can just lay down however you want to lay down. All right. So we see him in this situation. I'm going to pull this back a little bit. Okay. And in a spinal situation, we want to, if we're worried that there's any sort of spinal injury on a person, I'd like to make sure that you have somebody, you or if you have another person, put your hand on their head or their forehead or whatever, and then you just have one person and they're just going to be sitting here holding their head. All right? Well, if other things are happening, you have one person that is sitting there that their job is managing this head, neck area, if you suspect spinal injuries at all. I think that just helps us to remember that. If you're by yourself, you do the same thing. I'm going to just come, I'm going to put my hands on his head or his neck, just so that I'm reminding myself that when all the things I'm doing, I'm remembering spinal precautions. So that's really important. So the other thing is we're looking at a mechanism of injury. It's called an MOI. So did something happen that we either witnessed or heard about that we'd suspect that there was a spine or neck injury? So say like everyone's like, he fell off the roof or he fell off the cliff. Then I'm like, then we're like, okay, or he fell out of a tree. So any sort of big falls where the spine would be compressed, it would be a concern. Another thing would be if there was like he was jumping or something and something caused his chin to like hyper extend the cervical or the neck vertebrae. That would also, like a skiing accident or any sort of large tumble or something like that, where you'd have that chin popping down to the chest. That's called excessive flexion. And then also just skiing is a good one, I guess, or snowboarding. When you're doing, you have a low momentum and you're falling and the skis didn't pop off. So you know that that body was twisting and moving as it was going into speeds. And so things may have been torquing and stuff in the spine that could cause an injury. It's called an, attempted hanging. If anything, like we know that something was around the neck and it pulled that spine that way, could be a concern. A gunshot or stabbing. If there's an actual wound in the spine, in the neck, we'll also suspect some sort of spinal injury. And then if there was a sudden or violent deceleration, so that would be like took a fall and impacted, or a car accident where they hit something in the car, something really hard. So all those kind of things could cause that spinal column, that nerve that's inside that spinal column to get injured in some way. So all those things we want to be careful. If we heard that or have suspicion that any of those things happen, then we want to start thinking about spinal precautions. Also, I think if you come upon somebody who's like this, unconscious, we have no idea what happened, we're going to assume that there is some sort of spinal injury. So we always assume that first until proven otherwise. So the other thing is the signs and symptoms that we're looking at, just make sure that someone had an injury. The first one is if we have pain or tenderness, or any obvious like torque, something looks really screwy. If the person says, my neck hurts, you know, you'll see that in sports injuries. My neck hurts, my back hurts, you saw them take a hit. If they have altered, this is if they are conscious, they can say, sorry, he's taking it out. If his extremities, like my hands are numb or cold or something like that, and the legs or something, unusual weakness could indicate that there's some injury in the spine. If he has difficulty breathing, that could indicate some sort of injury in the cervical vertebrae. If he has loss of bowel, if the person has loss of bowels, that's also a different part of the spinal column. And if they have symptoms of shock, just like passing out, they're going pale, things like that. So all these signs and symptoms will start presenting themselves, and you're just going to be kind of looking at those things, and they can be indicative of whatever part of the spine may have been injured. So just think about that. Have that in your mind. So we're going to go into management. So we see somebody in this injury. We need to decide what to do. So if say like we find our victim here and his neck is in a really screwy, maybe have your body really contorted, like you had a really bad fall. Yeah. Something crazy. Yeah. Maybe turn the other way so they can see you. Okay.
I don't know. I'm not a good actor.
So the idea is that we need to decide if we are going to be moving this person at all. Now, if you're in your regular car and you come across something and you suspect a spinal injury, because we're close to help, you know, you can just, you know, I'm going to stay here, make sure nothing happens, that they're looking, as long as he can breathe, he's got those ABCs are okay, then we're just going to maintain his stability, his spinal, you know, stability, and call 911 and have them come. But if we're in the mountains and we're like, we have to evacuate this person, obviously, you know, they can't come to us. There's either the paramedics or, you know, search and rescue are going to have to take him and move him somewhere, move that person somewhere. We need to get him in a position where they can be moved. Does that make sense? So that's when you're thinking, you know, do I want to align spine and neck or no? If no, it's no if we are close to help and we know they're on their way. But if we are far away, then yes, we're going to make our attempts to at least get them in a position where we can move them. So the position that the goal we're ending is on their back with their neck straight, their whole spine straight. And that is a perfect position that we can use to move and get people places safely. All right, so we've got somebody who's got maybe like their neck is all super torqued out. What we want to, this is actually a really nice neck position. So say like your neck is like super kind of twisted or all sorts of weird thing. We want to gently support the neck and the face and kind of put it into more of a normal alignment. Now the trick, you want to be slow and gentle in bringing that into alignment, making sure that if you ever have any resistance or pain, the person screams out, then you stop. But otherwise you can try and gently move them into a position for that spine to be, that C-spine to be in a good position. Same with the back. If the body is in weird angles and just all contorted, we'll do our very best to kind of slowly move that into a good position so we can get them into the position we want to get to. So slow, gentle, but if you hit friction, if you hit resistance or pain, then we stop. All right? Or do the best you can. All right, so the first thing he's gonna have to hear, just 1 minute. If we have, something happens and we need to evacuate somebody really fast, say like, okay, we've got an injured person here, we know there's spinal issues and things like that, and we need to get them, say there's an avalanche coming, rock slide coming, you know, something that's impending in a serious condition. Hey, Brian!
Hey.
He's our PA, so he can feel free to join in at any time. if we have our patient, I'm going to have you on your back for this. There's a technique called the beam. It's BEAM, body elevation and movement. It's a technique that they use to move people to a new location if we have to, and if you don't have a litter or something to move them. If you have enough people, it works out really good. I included a video on how to do it. I'm not going to be able to do it by myself, but obviously you would have a person. Your head person's the one in charge. They're the one stabilizing the neck. And then you have all your other people. You have ideally at least 2 on each side. And what they're going to do is come in underneath. I'm going to have you scoot over about 3 feet on their back. That's 3. And they're going to put their arms like this under the arm and the back and get in as close to the body as they can. So you have someone like this, someone down by the legs, here, here. And then all at the same time, your head person's in charge, and they're gonna say lift, and we'll all lift at the same time to our knees, and then they'll say lift again, and then we'll all lift and stand. And then if you wanna just check out the video, it was really good. It's a simple explanation of how to do that, like 5-person lift and how to move someone and it's for short distances. If they're all injured on like a rock bed or something like that, we just got to get them to the trail. You know, that'd be a perfect situation on how to do that. So that's called the beam technique. So check that out on the video. It's pretty cool. The other thing I wanted to talk to you about, one of the biggest things is the log roll. And so I included a video on our training as well on how to do, it includes 1-person and a 2-person log roll. So we're gonna be doing that. That's probably the most common technique that you're gonna use if they're face down on their belly. All right, so I'm gonna have my awesome husband come over and roll. All right, so let me see if you guys can see okay. I'm gonna pull this down. So hopefully we're not going to be on any activities where you're going to be by yourself, but if you're in a situation where you're like this, then it's good to know. So I've got him in this position. Usually the back of the head, I like to roll in that direction. So I'll take his arm, I'm bringing it up here, and then I'm going to go to his legs. I'm going to straighten them out gently, checking for any sort of injury, and then I'm going to cross over the leg, going in the direction that we're going to be going. So it'll be those ankles. All right. And then I'm going to take this arm. I'm going to go under his arm and cup my hand around his neck to provide a cushion there when we roll. So I'm going up here, and I've got my hand protecting that neck. And then I take my other hand and I'm using the hip. When we do rolls, you want to protect head, neck, and then you've got shoulder mass and hip mass are the things that you're going to be focusing on. All right, so I've got my hand on his belt, somewhere where I can grab it nice and snug. And then I'm going to just move him over on the count of 3 to myself. 1, 2, 3. And then going up and over protects your pivot. Keeps that spine in alignment and keeps, that neck and that fulcrum just in a nice, even, we want to keep this as straight as possible. Brian, do you have any comments on that?
It's not muted. No, it looked good. That's what they taught us in their advanced wilderness life support class, was basically exactly what you just did. It's a maneuver. I mean, if you were in a situation where help was coming and you could hear the ambulance coming, probably would keep them where they were and not moving. Unless, like you said, there's a dangerous situation, like a fire or they're, whatever, and then you want to get them moved, you kind of just have to do what you have to do. But in some situations, if an ambulance is coming, you don't necessarily have to mess with somebody too much and move them.
Yeah, and we talked about that. I think you missed that. That was at the very beginning. Yeah, if you're in the city and you're close, you just keep that, you keep them still. Don't let them move. Make sure that they stay in alignment as best as you can. Yeah. Don't worry about it. We're only doing movement and stuff like that when we're in a wilderness situation and we need to do an evacuation, or we see that we're going to have to evacuate this person.
Yeah.
And we need to get them in or if there's an airway that's getting blocked or something, we need to get them in a position that they're, in a better a safer situation. All right, so that's the one person. We're gonna do a two person. All right, come on over here, cutie. Our family has small people, so this is our other volunteer, my daughter.
Hi, Melanie.
Right. So if we've got two people, we're gonna do the same kind of situation. So the back of his head he's turned this way, so we're gonna roll him towards in this direction. We're gonna do the same thing. Pull this arm up. Okay. All right. Now the person who is the head, I heard a great technique to have your hands pre-crossed. And then when you've turned them, then you're in a position where your hands are not crossed. So that's in the video, so you can kind of see how he does it. So I take the opposite arm. So we're turning to the left. So I take my right arm, thumb down. I slide that under his head and his neck to provide support on that whole C-spine. And then I take my other hand, I'm putting that on the top. So the head person's the one in charge. I'm gonna straddle his arm actually and scoot a little to the left. And then my other helper, she's gonna grab the shoulder, then the hip, and pull towards her. So it's a different motion. With the one person you're pushing, with two men you're pulling. All right? And on the count of three, we'll turn. 1, 2, 3. Great. All right. Did you guys see that okay?
Mm-hmm.
All right. When you have more people, it's a little bit easier. Thank you, sweetheart. All right. Brian, do you have any other comments on the two person? Brian, any comments on the two person?
Yeah, just like you said, the more the merrier. So when I've done it in the field with people, you know, you get a bunch of people together and they all can grab a body part. And then, the key is to have the person at the head lead to turn so that they're not, you know, that you don't have somebody moving somebody out of kind of a twisting motion.
Right. Absolutely. Yeah. Just remember that your whole goal is to keep that head, neck, spine all in one line. So as they're rolling, the person who's got the head is going to be, even when they're going over that shoulder, that head's going to be a little bit up in the air because you're trying to keep that neck stable. Yeah. Awesome. Thank you. All right. Thank you. We're going to do C-spine. So we did the log roll. So we're going to talk about how to stabilize this neck. So now that we've got our person on their back, a little tip is when, if you're able to think ahead, when you're doing that log roll and you have them on their side, before you totally before you lay them back, someone on the back can actually go down the whole spine and just do little touches to make sure if there's any pain or discomfort or anything like that along the way. And you can kind of do a quick check. And that's a great time to slide a pad underneath the person. So when you bring them back, then they can be on this pad. So even if you had someone on their back and we have a pad on the side, we can all get together, log roll them to the side, someone slides that, and then we log roll them back. Does that make sense?
Yeah, and Emily, just one thought. If you are in a wilderness situation in the snow, the ground can be really cold. So taking the opportunity to roll the person, throw some stuff underneath, that you'll help them with the shock and trauma because you have to keep the patient warm. And you'll put stuff over the top of them, but getting something underneath is really important.
Yeah.
Absolutely,
Sure.
absolutely. That's part of our ABCDEs. The E is the environment. So we're in a situation that's really cold. We want to protect them from the snow and the wind if we've got other inclement weather. And then also if we're in a hot situation, we need to get them to a place where we've got shade, where we've got water, other things are going on. So you don't want to leave an unconscious person just baking in the sun. Obviously, they're going to have other issues after that too. So, all right, good. So if you're in a city situation, sometimes people keep C-spine collars in their cars, or like the EMTs when they come, that's going to be the first thing they're going to do is click that around their neck. But in a wilderness situation, we obviously don't have those kind of, we are not going to be packing those. I'll just tell you right now. So a way to make a makeshift, I'm going to have you scoot back.
Yeah, sure.
To the right. As much as Dee wants to lay on the floor all evening. Okay, I'm going to pull this up a little bit. Okay. So I've just got a jacket here. So you can do this with, if you had a really soft pad, you could do that. It just seems like it'd be a lot easier for clothing though, because it's a little bit more, can mold around your neck a little better. So I just have a jacket, a fleece jacket, and I flip down the hood and I put the arms inside. I don't know if this matters at all. And then I tuck the arms in, so it's about this long. So I tuck the arms in, and then I roll that like this. And that just seems to be a good length to get around the whole neck and also provide a gap in the front, because we need to make sure that we're not choking and that they can still have a good airway and we have access to the airway as well. So, so we would try and be very gentle here. Making sure we keep everything in alignment. And then I'm going to pull this up here. If you want to, let's see. And then what I would do, take medical tape. This was a technique, and Brian might have some other cooler ones. A long strip. And then I've got that. And I just use that as a tape. Make sure that's nice and snug, but not too snug. My medical tape's a little poor, but all right. But the idea is that this is going to make sure that it helps him to remember not to move it, and it also makes sure that we're here. And we'll still have someone watching this area. As long as he's in our care, someone's going to still be managing head and neck. Also making sure that we've got a gap and that they can breathe okay. But this just provides protection to keep that neck from swapping back and forth, especially if we're going to have to move them, transport them in some way. Brian, do you have any comments on that?
Yeah, when first responder courses I've had before, they can use a SAM splint.
Yeah.
Which is that aluminum foam splint.
We will have SAM splints for arms. So.
Cross it. Yeah, you can use those for, I mean, they're not the greatest. They're not like a regular, but they hold pretty well. And then you want to make sure that you put something on either side, keep the neck from moving side to side as well. And then you can use like a backpack strap or something to wrap around there, and you can try to get their head pretty still.
Yeah.
When you're trying to do
so if we had him immobilized, if we had him on this pad, we could probably put like a pack here, and strap it down so that he couldn't move that head at all.
Yeah, you can use it'd be interesting to show you guys, but basically you take a backpacking backpack and turn it upside down and have them lay on it. So their head is on the waist pad. They're on the waist pad that you'd have. And then you could use the backpack straps to come around and hold stuff and make it really
So like the waist bands, the waist straps are around the head.
Yeah. Yeah, and then you use the SAM splint as a seat collar, and you can put rolls like you just did on either side, and then you use the backpack straps to come over the top, and you can actually do a pretty decent C-spine immobilization like that. But it depends on what you have. It depends on, but again, you'd have to, if somebody has a C-spine injury, I'd really have to convince myself I'd have to move them pretty far to want to even do that. But it may come up that you just need to.
Yeah, I mean, it's good to know. You always want to defer to someone who has more medical experience, especially if they're close. But if you're like, we're overnighting and we've got issues and we got to go somewhere, it's good to know. Yeah,
for sure.
Awesome.
You can learn it. It's just a matter of, if you're up in Alaska and you're out pretty far, or, if you're hiking the Y, obviously you probably wouldn't do that. But if you're, if you're like out, in the backcountry or something up above Zion, then you may have to, it's inclement weather. There's light, all kinds of reasons why you might need to move somebody, flood or something.
Yeah, absolutely. Great. Thank you.
And just stabilizing the neck too, while you're waiting for somebody to come transport. That's important too. Doing it correctly. That's important. And then if you have to do CPR because the person's just out, then knowing how to properly immobilize the C-spine while you're doing CPR or something is also really important. So it's an invaluable skill. Absolutely.
The last point I wanted to make is that if they've got to be moving, like EMS or search and rescue or whoever's going to be coming, if they need to move them, they're going to be using a hard back litter, like a hard backboard, and that's the ideal situation to move anyone who's got spinal precautions. So they're laying flat on that backboard, if you guys have seen that. And then they've got those 2 nice, really big blocks or whatever you've got available to strap down that head. And then they've also got straps over the person's body to make sure they're not moving or going anywhere. And then you use as many people as you can that are available, and they each have a handle, and we try and move that person out. So, and then you also, you always want to make sure you can get padding and any of those gaps on that, when that person's on that flap, or as you see, there's a little gap. We would have a C-spine that would help, our collar to help with this, but there's a little gap on the lower part of the back, behind the knees, things like that. You would probably provide a little extra cushion, and then also they would be strapped down. Anyway, so that's the big thing. Do you think we should worry about evacuating somebody like that if we have if there's a suspected spinal injury?
Like I said, you know, if you can get help, and you're going to mobilize them anyway, because you don't want the person to move around. And then you got to treat any immediate wounds, trauma, obviously any immediate bleeding that might occur, you know, do a head to toe, do a blood sweep, as they say. And if you're on a trail and, you know, you get called out to search and rescue, if you have a radio and it's like, oh, we're gonna be there in 2 hours. You're like, well, you know, we could potentially speed it up. But they also have, like in Utah, they have helicopters and stuff. They can come out and rescue people that are pretty remote. So if you're at the edge of a cliff, it would be difficult to hike down. Maybe you know, the number in your group is small and it'd be hard to lift and carry somebody. If you're just like you and your husband, or you and a friend or whatever, then so just kind of situational. But then if you're in, like, you know, foreign country and you're potentially doing something, then, you know, that could be different, because the rescue system might be completely different. You might know more than the rescuers, like you probably do. So, I mean, I went to Guatemala on this medical trip, and I talked to their ambulance guys, and they actually didn't have anything in their ambulance. Like, they showed me the ambulance, they opened the door, and there was nothing in their ambulance except for a bed. They didn't even have oxygen. There was like gauze and no C-spine equipment, no backboards, nothing.
Yeah.
So the more that you know, the better off you're going to be, depending on the situation, you know?
Yeah, perfect. Thank you so much. Thank you. I just had one last thing, is when you want to stop spinal immobilization. So obviously we have any of those, you saw mechanism in injury, and we have some very obvious signs and symptoms of spinal injury, you know, we're going to stay there. But say like you find somebody, you don't know what happened, we've just been watching them. If you're seeing that there's no signs or symptoms of a spinal injury, they're alert and oriented, they have no severely painful injuries, especially anything in that spine or neck area. They're not deep psychologically distressed, like they're not freaking out. Their extremities feel normal. Then that would be something to consider, that we might not need to do spinal precautions, especially if they have other injuries like an ankle, a fractured ankle, or something like that, that we would need to evacuate them. So we can say, all right, we're going to watch you, make sure you're doing okay. And maybe, you know, if things are looking okay, then we could try and slowly sit them up and kind of keep a close eye on them, things like that. And you want to move that slowly, and then, you know, go from there. Any other thoughts on that, Brian?
Yeah, so in the ER, we use a thing called the Nexus criteria. So you're looking at, but I mean, these would be trained people that have done them a lot, but you're looking for midline tenderness along the neck, a distracting injury, like if they have some kind of open fracture somewhere, then, you know, you think, well, they're not reliable. If they're intoxicated, you know, maybe not, people in your group might not be, but there might be somebody you run across that's drunk, then they become an unreliable historian. So you just assume that they could have an injury. And the alcohol could be masking the injury, or like you said, if they're in distress, or they're, you know, but if somebody's able to tell you like, oh, my neck doesn't hurt, and you push down their midline, you know, but if they had a mechanism of injury that was significant, you probably suspect it. If they have any kind of altered mental status at all, then I'd probably just assume do the precaution and take that precaution if you're going to transport them. You know, then they may not have a neck injury, but it's not going to hurt them to be safe. So err on the safe side with neck injuries. That's, I guess, the sum of that up.
Absolutely. My very first traumatic situation I came on was a car accident up in the mountains in the middle of the night, and these teenagers had wrapped their truck around a tree, and they were all drunk. And there was a guy sitting behind the passenger behind the driver, had his head stuck between the tree, the car frame, and the inside of the car seat anyway, and that head, he was jammed down there. And of course, that was the one thing.
Oh,
We
yeah.
were dumb. We didn't know anything. And I think he was already gone when we got there. But, you know, we did our best to try and do CPR, but our spinal precautions were abysmal. You know, like we had no idea of what we were, and in a situation like that, you know, you just do the best you can because we were so far from help and things like that. But yeah, you know, you keep things in mind. If you're close to help, you let the other professionals take care of it. You keep things simple. Keep things in alignment as best you can. Make sure their airway and, you know, the ABCs are taken care of. And then, yeah, we do what we can to transport if we have to. Yeah.
Yeah. I mean, any kind of motor vehicle accident, you're just assuming, because it's a higher energy injury. And they may be sitting there and they're looking fine, but they could have a neck injury because the way their neck slams around inside a car, because you're looking at going 30, 40 miles an hour and then just hitting a tree.
Yeah.
Or another car, then yeah, you're going to assume that there's some kind of injury.
Yeah, deceleration injuries.
We had an emergency room doctor that I was working with when I was a student, and we had this multiple MVA come in with like 5 patients at once. And she just walked around and she touched the back of their neck and she said, "Does it hurt here?" And the guy's like, "Yeah, I think so." And she goes, "Wrong answer." And she put a C collar back on. They did a CT. They did a CAT scan to look at his neck.
Yeah.
And then
there's certain things you say that get you attention.
Okay, you get a CT, you get a CT, and you get a CT. All right. Have a nice day. Here's some pain.
Well, I want to thank you guys. Thank you, Brian, so much. He's our unofficial medical advisor. So hopefully we get to see him on more of these, and he'll keep us straight so we're teaching you the right stuff. And yeah, we're excited to keep doing these, and we'll see you guys later. If you want to join us for the second half, we're going to be talking about winter clothing layering and how important that is. So we'll see you guys in a few minutes on the same station.
Okay.